Welcome to Medical Mondays, Episode 2. I'm Patrick Gavin, President and CEO of Hunterdon Healthcare. Today we're going to talk about what to expect when Hunterdon Healthcare sets up a mass vaccine clinic so that you will be introduced to how to arrive there, what you should expect, and be educated a little bit about the vaccine. Let's begin with explaining where the clinic on our campus is located and how to find it. First, enter through the main entrance off Route 31 onto Westcott Drive. As you approach the hospital, look to your left and you will see signs with our heart logo on the road that will lead you to the clinic. There will be safety attendants along the way to help guide you if necessary. Follow the signs to the rear of the hospital where you will see an attendant station at the stop sign. The attendant will ask if you have an appointment. Please remember that you must have an appointment to get the vaccine. We are not able to vaccinate individuals without an appointment. The attendant will take your temperature and ask if you've had any symptoms related to COVID. If your temperature is normal and you have not had any symptoms, he will provide you with a vaccine questionnaire to complete before you enter and ask you to park your vehicle. Once you have parked and completed your questionnaire, you will walk down to the rear entrance of the hospital where you will see large informational signs and likely a short waiting line. You will not be able to enter to receive your vaccine until your time window has arrived, so please do not take a spot in line any earlier than 5 minutes before your scheduled appointment. So our first guest today is Dr. Rose Pulley. Rose has extensive public health experience specific to large vaccination clinics. So Rose, based on your past experience, why is a vaccination important and how safe is this particular vaccine?
Now, vaccine is extremely important because it offers the most protection available to a deadly disease. COVID-19 has killed over 400,000 Americans, and getting a vaccine safely and effectively is the most protection you can provide to yourself. It's really an act of kindness. You're being kind to yourself and supercharging your body to protect you from this virus, and you're being kind to your friends and family so that you can interact with them safely, and you're being kind to your community because you're helping protect us all.
And how safe do you think it is, Rose? Is there any flags there?
It's very safe. It had an accelerated process, but it still went through the FDA approvals that are necessary for a vaccine. Vaccines are one of the most regulated products in America.
And Rose, from your extensive background in public health, how does this pandemic compare to the likes of Zika, SARS, and even just the annual flu?
It's much larger and much more deadly than other pandemics that we have experienced here in the United States. And particularly it's causing changes in lifestyle. And one of the big factors here is that we're seeing increases in hospitalization of patients. So the number of people who need to be treated for this disease is more than we've seen in other pandemics.
Okay, great. Thanks, Rose. Now, another couple questions here. So how will the clinics here at Hunterdon be staffed? Can you just talk a little bit about that, and then we'll get to others that will get into more detail.
All right. We have wonderful staff here at Hunterdon Healthcare. And the clinic team is composed of really two branches. The first branch is our clinical team, and that is composed of our vaccinators, and they man the immunization stations that people will sit at to actually get their doses of vaccine. It's also composed of our pharmacists who prepare all our doses. And then there's an administrative staff who provides a registration process and also the documentation to upload our information to the New Jersey immunization information system so that we can account for every dose of vaccine that we receive.
Rose, you touched on this, but could you speak a little bit? There's lots of questions that I think folks in the public have about how the vaccines are prepared and how quickly do they have to be administered?
They have to be prepared very carefully. So we have special freezers here for the Pfizer vaccine and medical grade freezers for the Moderna vaccine, and the other vaccines will be stored in appropriate conditions also. But once they're thawed, they have to be used within a very specific time frame. They have to be thawed in a very special way. And then once they're put into a syringe to be delivered and at room temperature, they have to be used within 2 hours. So when we do a clinic, the pharmacists are constantly preparing vaccine as people move through the clinic.
So Rose and I are entering the clinic at the hospital site, and we'll take you on a tour of that. But actually, as time progresses, we will be running these clinics in different locations throughout the county and even into other surrounding counties where Hunterdon Healthcare serves significant populations. So now I'm going to take you inside the hospital vaccine clinic. And the first person that's very important to meet here is Tony Rice. Normally, Tony is a human resources director who takes care of benefits and wellness for our health system and all of our employees. But like many people in the health system, during the pandemic, Tony has assumed more than one role. And Tony has taken on the very important role for us of being our clinics manager, our vaccine clinics manager. And Tony's going to talk to you about the front end when you come in, how you register, how you get received into the clinic, et cetera. So with no further ado, I'm going to turn it over to Tony to walk you through that process.
Thank you, Patrick. When patients begin coming through the registration area, they'll come through the main door. They will be greeted by someone that's going to verify that they have an appointment scheduled for today. They should receive paperwork before they come through the registration area that they'll be completing. We will have people here to assist them with the paperwork as they come to the door. And there's just 2 boxes that they need to check and then sign at the bottom. Once they come into our registration area, they'll be directed to one of our registrars. We have 6 registrars here. And then they'll be offered the opportunity to provide their insurance card and their driver's license. If you don't have an insurance card, that's fine. We will continue to do the process without insurance cards. We will need some form of identification just to get demographic information from you. Once you're registered, you're going to be led to another area where you will be lined up to do your vaccination. So there's a vaccination area that you'll go through next. Some of the reminders you might want to consider before you come to the clinic is you may want to use the restroom before you come. Because once you get vaccinated and you go into the period of time that you wait, there's a 15-minute observation period, you're not going to be able to use the restroom. We're going to ask you to remain seated and in that area to be observed for at least 15 minutes. So you would want to use the restroom before coming. So driver's license, insurance card, restroom, and then also please consider wearing layers. You may be waiting outside. And you would also want to be able to take off a layer and perhaps have a short sleeve shirt underneath. That'll just make it a little bit easier for you to be vaccinated. Thank you so much.
So now we're in the actual vaccination clinic where the needles will go into your arms. And I'm here with Dr. Barbara Tafani, who runs that for us. And Barb will walk you through exactly what happens through the process and even after you've been vaccinated. With no further ado, Barb, would you mind walking folks through that?
Absolutely.
Thank you.
Patrick. Okay, so welcome to the vaccine clinic. So you're going to come out of the registration area and into the vaccination area, and you're going to have your questionnaire with you. And you'll have filled that out in the car, as Tony had said. The vaccinators will review that questionnaire with you just to make sure that we have all the information we need. One of the most important pieces of that questionnaire is, have you ever had an allergic reaction to a vaccine? If you have, we'll talk you through what we need to do next. If you haven't, you'll just come right into one of our vaccination stations. You'll sit down with one of the vaccinators. The shot itself only takes a couple of seconds to administer. We'll administer it high in your arm, in your deltoid muscle, and the muscle right up here. I've given a lot of vaccines over the course of the past few weeks. Everyone has said pretty much the same thing. It's a relatively painless vaccine. It doesn't take long. Then you'll leave the vaccine station, but before you go, you're going to get a card. And this card will have the information about what the manufacturer is of the vaccine, the lot number of the vaccine, the date you've gotten the vaccine, and where you got the vaccine. That card is really important. We'll talk about it a little bit more over in the observation area. So when you leave the vaccine station, you'll come over into the observation area, and you'll have a seat in one of these chairs. And we're going to ask you to stay in this area about 15 minutes. And the reason is we just want to observe you and just make sure there is no reaction to the vaccine. The chances of having a reaction are very small, but we want to just take that extra precaution with you. I talked about that card you're going to get. While you're sitting waiting that 15 minutes, one of the things that we're going to ask you to do is take out your cell phone and take a picture of that card, front and back. So that way, if you lose the card, you will still have some record of the information, because that information is really important. You're going to want to know, did you get the Pfizer vaccine or did you get the Moderna vaccine? You're going to want to know the lot number, and you're going to want to know the date that you got your first dose, because you're coming back with us for a second dose. While you're here also, we will have given you some information about the vaccine. And we've also given you a sheet of paper about a CDC website called vSafe. vSafe is a website that you can register on, and they will help you track your symptoms. They'll follow up with you to see how you're feeling, and they'll actually send you a reminder when it's getting close to the time for your next appointment. We encourage you to go in and register on the vSafe website. It's certainly not required, but people who have done it have found it extremely helpful. It's also a great way to collect continuing data about how people are doing with this vaccine, so that we can monitor the success of these programs. When you're finished in the observation unit, you can come over to our social media area. And you can take a picture of yourself, and you can actually send it out to people to let everybody know that you have gotten a vaccine, and encourage other people, friends and families, to do the same. Before you go, I just want to ask you to do one more thing. Pay attention to how you're feeling in the next 24 to 48 hours after you get your vaccine. Most people do extraordinarily well and have no problems at all. But if you are not feeling well, if you are having fevers, chills, body aches, in the first couple of hours, that's not that uncommon in a very few number of people. However, if it continues, or if you have rash, body aches and fevers that extend more than a day, please call your primary care provider. We'd rather be safe than sorry, and no physician will ever mind you calling just to check to make sure that you're okay. Once you take your picture in here with us and send it out to your friends, you are free to go. And you'll just leave the clinic right through this door, and this patio and walkway take you right back out to your car. We are happy that you're coming to us at Hunterdon for your vaccine, and we will see you again in 3 to 4 weeks.